Good evening, everyone. Thank you. Welcome tonight. Thank you very much, everyone, for coming and spending the evening here tonight. My name is Dr. Devin Harris. I'm an emergency physician and now Chief of Staff at Kelowna Hospital. A lot of you I haven't met because I've only been here for a short time, but many of you I will meet over the coming years as well. It's my pleasure to be involved with KGH and others in continuing the journey of it being developed to an academic health sciences center that's provincially and nationally well known. So that's our goal, so you'll see more of that. I first want to introduce our hosts, Al and Irene Hildebrand with their grandson Josh, and just want to recognize them tonight as well. So thank you very much, if we can give them a round. This evening is being called Not Alone, and along with the campaign with the same name, Not Alone, it's to recognize an open access care center called Foundry Kelowna to help children and youth with substance and mental health issues. And if you look just over the side from our 17th floor view, we can actually see it just outside the window here. I came to Kelowna 2.5 years ago. I had been an emergency physician here for only a short time. But prior to that, I was an emergency physician in Vancouver at St. Paul's Hospital. There at St. Paul's Hospital, we saw patients, families, individuals from the downtown east side. Downtown east side has been called, as you probably all know, the poorest neighborhood in Canada. It has high levels of addiction, mental health, homelessness, violence, and other issues. And at times when I worked there, it was a very difficult job. We saw individuals from the downtown east side who had mental health or addiction issues, and at times when I worked in the emergency department, I felt like I couldn't do very much. At times, in the brief moment or interactions I had with them, I was able to ask people and have a bit more of a conversation with them. Some of them were from the Okanagan. Some of them were from Kelowna. And for me, who was raised in Penticton and came from such a beautiful place as the Okanagan, I always questioned how they ended up in the downtown east side. Those of us who worked there many times who saw individuals from the downtown east side, we felt that there wasn't a point where we could intervene. We felt that people had been there for so long and had been entrenched in their lifestyle so much that we couldn't change the trajectory of where they were or what they were doing. However, there are those people that we saw there, often children and youth, that we felt who were new to the downtown east side that we felt we could make a difference. And as those people that we spent a bit longer time. As an emergency physician, you don't have much time in between acute crises to be able to talk to people. But in those instances, I thought that I could intervene, offer some help, make some suggestions, a referral, show that you value the person in front of you, and hopefully change the trajectory of where they were going. But we never knew if that would ever happen. My hope at those times was that there was something upstream, something further back, something in their youth or something when they were children that could prevent that moment where it came to where I saw them as an emergency physician at St. Paul's Hospital. And to us, that's the Foundry. So to us, we think, and all of you will probably believe the same, that this is a moment where we can have that early intervention, where we can provide that all-encompassing care outside of an emergency department to impact families, to impact individuals, to impact care providers, and those of us who live here and throughout the province. There is stigma behind mental health and substance use disorders. Current Canadian mental health campaign states that 1 out of 5 of us are affected with a mental health disorder. Although 5 out of 5 of us are affected by it, which is true. The KGH emergency department itself is seeing increasing numbers of mental health and substance use presentations for children and youth, and in fact it's exploding. We've almost tripled the number of presentations in 2 years only within the emergency department. So there is urgency for us to act, but there's also hope. That's why we're here tonight. So I want to thank you and appreciate all of you for taking the time to show up tonight, for the Hildebrands for hosting us here tonight as well. And I look forward to meeting you all in my years here in Kelowna and for us to move this forward. Before we move on, I also want to acknowledge those of you who work with children and youth and mental health. Those of you who have brought us this far, and those of you who will be working with in the future to be able to help shape the future here in Kelowna. So if you can please stand up so we can acknowledge you. These are our psychiatrists, our social workers, our care providers, those as well. If you can please stand up, we'll acknowledge you, please. So thank you very much to all those involved. So from this point, I won't be speaking as much, but more introducing as your MC. Our first course will now be served, and in a short time, I'll come back up and speak with you a little bit as well. So thank you very much. Enjoy your evening.